We are holding these sessions because we have this year a wider range of changes than we have in a typical year to our health insurance benefits for reasons that I will address in this presentation. We are also now finalizing our benefit guides, which we'll be sending out very soon. So please keep an eye out for those. One housekeeping note, for hearing impaired, CART services will be provided for this session. You can find the link for that in the Zoom chat. Our plan this afternoon is to do a 30-minute or so, 35-minute presentation followed by a question and answer session. So let's get started. So here's our agenda for this afternoon. I will start with a few brief comments about why we're here today. Then we'll jump right into the details about what's changing and what's not changing in our Medicare plans. After that, we will move into coverage for retirees who are not eligible for Medicare plans and therefore are covered under our active plans. And we will close with a few comments about dental and vision benefits, some tips for how to prepare for annual enrollment, and then we will move on to verbally addressing some questions that you may have. To the point of questions, you may submit them at any time during the presentation using the Q&A tab function of Zoom, which is typically located at the bottom of your Zoom screen. We will be reviewing those questions real time and responding to as many of them as we can in writing. Also right there in the Q&A tab of Zoom, we have a team of the GIC staff standing by to respond to those questions. With such a large number of participants, we may not be able to get to every question today, but we will, when we finish the presentation, verbally address questions that we've received throughout the presentation that we think will be of general interest to all attending. I want to note that for those of you who wish to make a more lengthy statement, we encourage you to use to send those to us at an email address, gic.info@mass.gov, rather than typing that in the Q&A. And finally, if you have questions about your specific coverage, including personal details, I encourage you to contact us directly using the phone number and online contact form. The information is here on the slide, and you can also find that on the GIC's website. We want to make sure that we preserve your privacy. So please don't share details of that nature in the Q&A. At the bottom of the slide, this is in case we have any GIC coordinators who may be joining this call. Thank you for joining us. We'll be sending you out training materials and a bunch of other materials very soon. So why are we here today? Why are we hosting this session? As I mentioned earlier, this is an unusual year for the GIC, and I want to explain why that is the case. So before doing that, on the next slide, I just want to remind you of our mission, which I hope you are familiar with. You'll see that you, our members, are front and center in our mission, and it's all about providing quality, affordable benefits that can give you access to healthcare that you need. To meet this mission, as you know, we provide a full suite of insurance benefits that you see here listed on the right-hand side. More specifically, we're here today because our annual enrollment is just a few weeks away. It will launch on April 5th and end on May the 3rd. This is the time when anyone eligible for GIC coverage can make changes to their insurance choices for coverage that starts on July 1st. Just want to also make a note too that we want to make it as easy as possible for you to interact with us at the GIC. So we've been hard at work developing an online member portal. A number of you have likely already registered for that and are using that. It's called MyGICLink. It is now available to all GIC members who have a valid email address. It's not a requirement that you use the portal during annual enrollment or at any other time during the year. We will continue to accept paper forms, and our staff is always a phone call away. But in the portal, you can do just about everything you do self-service online. You can receive updates from us quickly throughout the year. You can review your benefits, update your information, add or change beneficiaries to your coverage. And during annual enrollment, you'll be able to compare different options you have for health insurance and actually complete your enrollment through the portal. Every state and municipal active employee and retiree, again, if you have a valid email address, can register and use the portal. So I highly encourage folks to do that. So as I said, there are a number of changes to benefits this year, and I want to speak to why that is the case. We have to recontract with all the companies that we work with to provide you your benefits at least every 5 years, and we now are at the end of that 5-year cycle. Second, as everyone can well appreciate, the healthcare system is constantly evolving. So one example of that you're likely aware of is the merger of two of our longstanding health insurance plans, Harvard Pilgrim and Tufts. You're likely also aware that another partner of ours, Always Health Partners, has changed its name to Mass General Brigham Health Plan. So there's changes among the plans that we work with. There's also change in the healthcare delivery system. Hospitals are also merging into ever larger systems, and that tends to make healthcare more expensive. So we need to update our strategies there as well. New drugs continue to come onto the market, some miraculous cures, but also at an enormous cost. So with all of these challenges that face us, we have to adjust our ways of dealing with them throughout this process. Finally, when we contract with health plans, it's a good time for us to make adjustments to the specific features of each plan. So that's the time that we like to do most of those changes. So add all that together, and this is a year of more change than the normal year at the GIC. And that's why we're holding these sessions. All right, that aside, let's jump into benefits for those of you enrolled in Medicare plans, what's changing and what's not changing. So let's start with what's not changing for our Medicare members. And the good news is that there's a lot that is not changing. We continue to offer a wide range of choices for your coverage, both Medicare supplement plans and Medicare Advantage plan. Also, importantly, we are not increasing any copays or deductibles this year for our Medicare plans, so they will continue to be the same as they are today. There will be no changes to your prescription drug benefits, and we will continue to work with CVS Caremark to manage those benefits for you. And finally, there are no changes to the dental, vision, or life insurance plans this year. So a lot is not changing, and we want to start with that right out of the gate. That said, there are a few things that are changing that you really need to be aware of. First, as I mentioned earlier, Harvard Pilgrim and Tufts recently merged into one company called Point32 Health. Tufts will no longer, as a result of that, be offering their Medicare supplement plan called Tufts Complement. So that is not a decision made by the GIC, but by this organization as a private entity. So if you are in that plan today, you should know a few things. Number one, you will continue to be covered under that plan through the end of June. But second, during annual enrollment, you will have to select a new plan. The good news is that you have lots of options to choose from, as noted here in this slide, depending on where you live. Harvard Pilgrim, Unicare, and Health New England will continue to offer Medicare supplement plans. And for those looking to save a little bit on your premium, Tufts will continue to offer Medicare Preferred, which is their Medicare Advantage plan. As we always do, we will make sure that no one goes without coverage through annual enrollment. So if you are enrolled in Tufts Complement today and you do not actively choose a plan during annual enrollment, we will default enroll you in the most similar plan. So that is, in this case, Harvard Pilgrim's Medicare Enhanced plan. But it is important to ensure that you enroll in a plan that meets your needs, whether we do it for you, whether you do it yourself, so you can make a decision on the plan that really is the best for you. If you are okay with moving from from Tufts Complement to Harvard Pilgrim Medicare Enhance, we can do that for you, and there's nothing more that you need to do. But this is a good year to just make sure that that is the case. The second change is one I'm excited to share with you. It relates to the Medicare, Unicare Medicare Extension Plan. For those of you who have been in that plan, you know that it has included an optional component called CIC, or Comprehensive Insurance Coverage. You also know that you, in the past, have paid 100% of that additional cost. The state has not covered a percentage of that as it does with your regular premium. As of July 1st, we are folding this member pay all cost and the coverage into the plan. So what this means is that you will continue to get the same coverage you've had in the past with CIC, but the state will essentially be picking up its share of the cost for you. And that percentage, of course, is based on the date of retirement for you. So your coverage is getting better. The state is sharing its portion of the cost there, and we think this makes this this is a good and an overdue change to this plan. So on this slide, we pulled together the changes that I mentioned in the prior slides, and you'll also see this table in your benefit guide when you receive that. So based on the plan you are in today, you can see here what plan you will be enrolled in the coming year if you do not actively select a different plan. We know that many of our members do not actively select a plan. If you are okay with us placing you in the Harvard Pilgrim plan, again, if you're in Tufts Complement, we can do that for you, and there's nothing more that you need to do. So we'll wrap up the Medicare section here with a quick look at rates for our Medicare plans. So here we show the full cost premiums for each of our plans for fiscal year 24 and how they're changing from the current fiscal year 23. I want to be clear, the premiums that we show here are not the amount that you pay. This is that we will get to in the next slide. This is the total cost of the plan, which combines what the state pays and what you pay. What we do show here as well, though, is the percent increase in each of the plans that we offer from what the premium is today. We understand that any increase in premiums is a challenge, especially for those of you on a fixed income. But we have had a good deal of success that is continuing this year in keeping our Medicare premiums quite stable and increases quite modest. So you'll see the average increase for Medicare plans this year is 2.3%, and that breaks down to Unicare going up by 2.8%. Tufts Medicare Preferred, again, that's the Medicare Advantage, going up by 2.1%. Harvard Pilgrim by 1.2%. And Health New England premium is actually not increasing. That will stay the same as it is this year. So that's high level where our premiums are headed for the coming fiscal year. So what does this mean to you? So this slide, forgive, it's a little hard to see, but we wanted to make sure that we included this all here. This is a breakdown of what our members will pay for each of the plans that they enroll in, depending on the percentage that you pay based on your date of retirement. If this is hard to read, don't squint. You don't have to write this stuff down. All of this material, as I said, will be available in your decision guides, which are coming soon. Please note that, sorry, if you can go back to that last slide, this does not apply to municipal retirees. As you know, the contribution ratios for you are a little bit different. So you'll have to contact your city or town benefits person for more details. So that wraps up changes to the Medicare plans. The non-Medicare plans we'll move on to next. This is a little bit more lengthy of a part of the presentation, but I do first want to remind you that you may submit questions at any time during the presentation using the Q&A tab of Zoom, and at the bottom of your screen. We'll get to as many of those questions as we can in real time. And again, please be sure not to include specific personal details in the Q&A tab questions. All right, moving on to our non-Medicare plans. We do have some changes to these plans. And just a reminder, these are for retirees who are not eligible for Medicare, but instead enroll in our active plans. So at a high level, these are the companies that we're working with to provide coverage starting on July 1st for you. I'll speak to each of the changes that are sort of embedded here in turn in the next slide, the next set of slides. We will, starting in the upper left here, we will have a new plan offered by Harvard Pilgrim for those members who live outside of New England and are non-Medicare eligible. That's a Harvard Pilgrim plan. For those who live in New England, upper right here, you can see you can choose from a range of broad network plans offered by Harvard Pilgrim, Unicare, and Mass General Brigham Health Plan. Lower left, Health New England will continue as our regional plan for those of you who reside in Western Mass. And Harvard Pilgrim and Unicare will continue to offer limited network plans you see here in the lower right. So we'll get into more detail about the changes that lead us to this outcome. So before we do that, again, there are a bunch of things that are not changing for our non-Medicare plans, and I want to point those out. You still have a wide variety of choices. We continue to work with many of the same insurance companies. There are some specific changes to specific plans, which I'll get to. We continue to offer different types of plans. So we offer HMOs, which feature a closed network of hospitals and doctors with a designated primary care physician to manage your care. We still offer point of service plans, POS, which are similar to HMOs, but they have broader access to hospitals and doctors outside of the network. And we continue to offer indemnity plans, which give access essentially to all providers. We will also continue to offer broad network plans with wide access to providers, but also limited network plans for those willing to trade off that broad access for a lower premium if you're more sensitive to the premium. Second, while we are making some changes to co-payments that I'll talk about in some of our specific plans, we are not implementing broad cost shifting to members through higher co-pays, deductibles, and we are not changing out-of-pocket maximums, not increasing those at all. So a lot of that is not changing. Finally, there are no changes to dental, vision, or life insurance plans here, as with the Medicare plans. Again, just to make a note, we are not making any changes to the Health New England plan for those eligible for that in Western Massachusetts. But there are some changes that are coming to other plans. And so here, high level, first, as with Medicare plans, the merger of Tufts and Harvard Pilgrim means that Tufts will no longer be offering Tufts Navigator. Second, we've made changes that will mean that some of your options will be different in the coming year based on where you live. Third, as I noted earlier, we've made a few targeted changes to co-payments. I'll speak to those in a little more detail. And finally, the names of some specific plans are changing as a result of our decisions this year. So I want to walk through each of these in turn, starting with the Tufts change. Again, Harvard Pilgrim and Tufts merging into Point 32 means that Tufts Navigator will no longer be offered to our non-Medicare enrollees in the coming year. So if you are in Tufts Navigator today, remember first that you will continue to be covered under this plan through the end of June, but during annual enrollment, you will have to select a new plan or the GIC will make that decision for you and place you in the Harvard Pilgrim Explorer plan, which is very similar to the Navigator plan. The good news, though, is that you do have other options depending on where you live. Harvard Pilgrim, Mass General Brigham, Health Plan, Unicare, all of those plans will continue to offer broad network plans. And for those looking to save a little on premium, you also have Harvard Pilgrim and Unicare narrow network plans, as well as Unicare Total Choice, which I'll say a word about in a moment. It's important that no one goes without coverage, very important to us. So as I said, if you're in Tufts Navigator today and you don't act, we will place you in Harvard Pilgrim Explorer, and there's nothing more that you need to do. However, it is a good time, a good year to evaluate your options, and we encourage you to do that. Next, we move on to Tufts Spirit. As with Navigator, this plan will no longer be offered for the coming year due to the merger of Harvard Pilgrim and Tufts. Again, if you're in Tufts Spirit, you'll continue to be covered through the end of June, but come annual enrollment, you will have to make another decision, or Harvard Pilgrim will be the plan that the GIC will enroll you in, and that's the Harvard Pilgrim Quality HMO, another limited network plan. So again, trying to make sure that if you don't act, we're placing you in the most similar plan that we offer. But you also have other choices. You have Unicare Community Choice, which is another narrow network plan. And then we have all the broad network plans that I mentioned earlier from Unicare, Harvard Pilgrim, and Mass General Brigham Health Plan. Again, great year to evaluate your options, and we encourage you to do so. Moving on to Harvard Pilgrim, both their broad and limited network plans will continue to be offered much the same way that they have for the past 5 years, though they will have new names. The Independence Broad Network Plan will now be called Harvard Pilgrim Explorer. We've referred to that a few times already. Primary Choice, which is the limited network plan, will be renamed Harvard Pilgrim Quality HMO. So aside from the name changes, really not a lot of change to these plans. Moving on to Unicare, the indemnity plan, which has gone by the name Basic, is being essentially replaced with 2 plans. Number 1 at the top here, for those of you who reside outside of New England, there will be a new plan for you called Harvard Pilgrim Access America. I'll say more about that in a moment. And for those of you who reside in New England and are in the Basic plan, the Total Choice will be the successor to that plan, which will be very similar to Unicare Basic, will continue to be available to those in any of the 6 New England states. Again, I'll say something about each of these in the next 2 slides. So for many years, those non-Medicare retirees who live outside of New England have been covered by Unicare Basic, which is our most expensive plan premium-wise. As a result of our recontracting process, we're pleased to say that we're able to provide you a less expensive option through this Harvard Pilgrim plan called Access America. This new plan will offer similarly wide access to hospitals and doctors with no changes to co-payments, deductibles, or your out-of-pocket maximum. All of this at a lower premium even than you paid for Unicare Basic last year. So we're really excited about that. Also, as I said during the Medicare section, for this plan to succeed Basic, we are also removing that member pay-all portion of the CIC program, folding the cost into the premium, and the benefits will be the same as if you had CIC. It's important to note that eligibility for this particular plan is determined by the address that we have on file for you at the GIC. Again, it's only for those who reside outside of New England for 6 months plus 1 day. So please make sure, if you live outside of New England, that your address that you have here with the GIC is up to date. On to the next slide. As I mentioned, Unicare Basic is will continue as an option for those that live in New England. It will become Unicare Total Choice. Same broad access to hospitals and doctors, though there will be a few changes to the plan. Again, as I mentioned, with the out-of-area plan, we are here also removing that extra member pay-all portion of the premium from what was Unicare Basic, folding it into the premium and the coverage into the plan. Second, in an effort to make this plan a little simpler to use, have it sort of stand out a little bit uniquely from the other plans, we are doing away with tiered copayments and replacing them with flat copayments. This will continue to be the GIC's most expensive plan, but it will offer a simpler, easier to navigate plan. The next change is to Always Health Partners. As I mentioned earlier, they have changed their name to Mass General Brigham Health Plan. Again, a decision by them as a private company, not by the GIC. I want to make sure that folks understand that just because this health plan has Mass General Brigham in its name, it is not the only plan that gives you access to Mass General Hospital or to Brigham and Women's Hospital or any of their affiliated hospitals. You can still enroll in our other broad network plans, Harvard Pilgrim, Unicare, and have access to these hospitals and their affiliated doctors. Second, in the past, this plan has not been available to those who live in certain Western Mass communities, but we are now able to offer this to you no matter where you live in Massachusetts. Finally, and this is important, since this is now a statewide broad network plan, it will have the same co-payments and deductibles as the other plans in that category. So this will mean higher co-payments and a higher deductible for this plan than compared to how it is today. So if you're in this plan and those features are important to you, it's important to evaluate your needs during annual enrollment. Finally, Unicare Total Choice. Again, I've mentioned this before. This used to be Unicare Basic. It is still today through the end of June, Unicare Basic. And Unicare Community Choice, those plans will remain largely unchanged, though the name changed to Unicare Total Choice. We have made adjustments to co-payments for a subset of services for all Unicare plans. We've added co-payments for eye and gastrointestinal procedures that are delivered at a freestanding facility, as well as for outpatient services. And for Unicare Plus and Unicare Community Choice, we've made some minor adjustments to co-pays for non-preventive visits to your primary care providers. So in this slide, I thought it might be helpful to pull together all of the changes to member cost sharing that we've referenced in the earlier slides, adding a little bit more detail. You can see specific dollar amount changes here. Again, all of this will be made clear in your benefit guides that will be posted on our website very soon, if it's not already up. And I encourage you to review all of those. But here we wanted to give you kind of a preview of those materials and those changes. So before we get into premium rates for these plans, I want to share this table. Again, a little hard to read, but we wanted to make sure it was in here for reference. This, again, will also be in the benefit guide, but it shows each plan that we offer today and the plan that you will be enrolled in by the GIC if you do not choose your own plan. So when you get your benefit guide, please pay close attention to this. If you're okay with the plan that we have mapped you to in this table, nothing further is needed on your part during annual enrollment for your health insurance selection. But we do encourage you to evaluate your options, as I've said. Okay, so now we round up the health plan changes by saying a few words about how premiums are changing. As we did with the Medicare plans, we want to start with our full cost premiums. It's a little hard to read. Again, this will all be, all this material will be in your benefit guide, but here we want to show the full cost premium, which includes what you pay and what the state pays. What I'd like to draw your attention to here is the fact that while a few premiums for our plans are increasing significantly, more than 9%, most are increasing by much less than that, and some of the plans we offer are actually, the premiums are decreasing. So again, this is a great year to just check in, review your materials, make sure that the health plan that you have is something you can afford and meets your needs. And finally, on the health plans, this shows what our members will actually pay in terms of premium based on your contribution percentage, based on your date of retirement for the plans that we're offering this year. Again, this will be included in your benefits guide, and I encourage you to study it. All right, just a quick pause to remind you that you may submit questions anytime during the presentation using the Q&A tab function, and we will get to as many of those as we can. So with that, I'd like to turn to our prescription drug benefits and a change that is coming for our non-Medicare eligible retirees. CVS Caremark will replace Express Scripts as the company to provide the prescription drug benefit for non-Medicare insurance plans. Starting on July 1st, you will need to use your new CVS card, ID card, when filling prescriptions. CVS, the pharmacy benefit manager will reach out to you with a welcome packet and a new insurance card. There's a few things that you should be aware of. First of all, if you have a recurring prescription, I recommend that you take your new insurance card to the pharmacy to make sure you have, that they have your new information. Second, if you or a family member are taking long-term medications, for instance, for high cholesterol, you will receive a letter from CVS Caremark asking you how you'd like to receive your future refills, whether you want to do that by mail or at a local pharmacy of your choice. And as always, if you have questions about your coverage, you should contact CVS Caremark directly. The information will be on your new ID card, and keep an eye out for the packet that will come in the mail that should give you everything that you need to understand how to use this benefit going forward. Finally, I'll just say a quick word about our dental and vision benefits. As I noted earlier, there are no changes to dental benefits for those who are eligible, and MetLife will continue to offer this coverage. So really no changes here. And similarly with our vision benefit on the next slide, Davis Vision will continue to offer the same program for vision coverage. One last time, just a reminder to submit questions if you have them in the Q&A function. And we'll wrap up with a few tips on how you can prepare for annual enrollment. As I've said several times, forgive me for saying it again, it's a great year for you to really engage, pay attention to your benefits, and select a plan that meets your needs. So here we start with a brief checklist for steps you can take. First, plan ahead to make sure that you get us your changes before annual enrollment ends on May 3rd. I would strongly encourage folks to try to take care of this on the earlier side rather than waiting to the end. We want to make sure that we're able to help you, and it can be harder to do that when everyone waits till the end. Number two, check in with your insurance company, any plan that you're considering, to make sure that their networks include the doctors and hospitals that you want and that they have the benefits that you want. Three, contact your doctor to make sure that they accept the plan that you're considering. And finally, and this is always true, if you're turning 65 soon, visit the GIC's website where there's a wealth of information about steps that you need to take. Finally, when you're deciding on which plan is best for you, consider these factors. Where you live will determine which plans you're eligible for. And incidentally, if you use the member portal, MyGICLink that I referenced, it will only show you the plans that you're eligible for. So it will make it an easier experience for you. Second, what kind of coverage works best for you? Is broad access to providers more important? Are you looking to save a little bit on premium cost that comes out of your paycheck? Are the doctors and hospitals that are important to you included in the health plans network? As I mentioned, call them, find out, check out their websites. Each health plan has a provider directory where you can look up if certain doctors and hospitals are in their networks. What tier are they in? What would be the copay for you going to your providers under this plan? And then finally, how much are you willing and able to pay? GIC offers plans with broad access, lower premiums, broad access, somewhat higher premiums, and copays. But we also offer plans with a more constrained access to providers, but come with lower copays and lower premiums. So it's important for you to decide which combination is the right fit for you. With that, I close the presentation with this slide for your reference. It includes phone numbers and websites for all the companies that we work with, along with some useful information for other agencies. I want to note that the slide deck that we've used here is also posted on the GIC's website. So if you want to study it at greater length, you may access it there. And again, remind you that we will have these recordings posted online. So with that, I want to, just before we go to Q&A, I want to thank you for attending. Thank you for your patience. We have a lot that we wanted to go through with you to understand the changes this year. Please be aware that your health plans will be reaching out to you as well, particularly those plans that are changing or being discontinued. So keep an eye out for those mailings from your health plan. As I said, you'll be receiving your benefit guides soon. That will have all the information you need and resources that you need to access to make your decisions. And as always, just check the GIC website for anything that you need. That's mass.gov/GIC. With that, let's move on to the Q&A section. I will do less talking and we will do more listening and responding to questions. And I'll ask our Chief of Staff, Emily Williams, to share some questions that we've gotten in the Q&A that we think might be of interest to the broader audience. Emily?
Thank you, Matt. And as Matt said, I encourage you to continue asking questions using the Q&A function. And as we go through those questions, GIC staff is answering those questions as quickly as possible in the chat. And we will also pull the more frequently asked questions that apply more broadly to the group to ask and have GIC staff elaborate on those answers verbally. So before we begin answering questions, if we could just move back to the Medicare mapping slides one more time, since those were at the top. I've seen some people asking to take a look at those again, and we'll just linger there for a while we answer the initial questions. And the first question is, will this information be available after the webinar ends? Will members have access to the information shared today?
Yeah, answer is definitely yes. As I mentioned at the end, this slide deck will be available on our website at mass.gov/GIC. And again, as I mentioned, all of the key materials that are included in this deck will be included in your benefit decision guides.
Thanks, Matt.
And if you want to rewatch this or any of the other sessions, you can find them on our YouTube page.
Thank you. And we have a question. As members are evaluating the different plans, how can they find out if their doctor accepts any of the plan options?
Yep, good question. First, you can, as I said, visit the website of that specific health insurance company, and they will have a provider directory. They're required to by law and by contract with the GIC, and it will include all of the providers that are in their networks. You should also feel free to call them, call the health insurance company. And as I said earlier, probably also a good idea to just make sure to talk to your doctor's office as well to make sure that they accept that plan. And the key is not just to say the health plan's name, like Harvard Pilgrim, but to tell them it's Harvard Pilgrim. Let's say, for instance, Harvard Pilgrim Explorer. It's important to mention the specific name of the plan that's offered through the GIC.
Thank you. And we have a question from many members who are wondering what they should do if they will turn 65 after the annual enrollment date.
Yep, that's a question we get quite frequently. It's not a quick answer, so I'm happy to have Paul Murphy, our Director of Operations, to say a brief word. But I really would encourage folks to go to our website where there's a whole page dedicated to what you need to be aware of when turning 65. It can be complicated. So with that, Paul, maybe just give a high level.
Sure, I can do that, Matt. What GIC will do for members that are retired after annual enrollment and they turn age 65, the member and or their spouse, GIC will contact the member directly and the spouse directly, advising them that they need to enroll in Medicare Part A and Part B. And we will send a letter, and in that letter, the member and spouse can elect their Medicare supplemental plan. So GIC will contact you and your spouse 3 months prior to the 65th birthday, and you can make the election to the Medicare plan at that time. So you don't have to do anything during annual enrollment. You can transition into a Medicare plan when you turn age 65 or your spouse turns age 65.
Thank you, Paul.
Thank you, Paul. And we also have a question asking if we could give some detail about what the difference is between Medicare Advantage and Medicare Supplement plans.
Sure. So Medicare Supplement, so I may ask for others to clarify if I get some of this wrong. Medicare Supplement builds on top of standard regular Medicare and provides coverage for costs that standard Medicare does not cover. It allows you broad access to providers. You can go to any provider that accepts Medicare. So it really is kind of the broadest choice of a plan. Also, the plans don't manage care in the same way as a traditional insurance company would. It really all operates under Medicare's rules. Medicare Advantage is a different kind of option that's been around for a few decades now. It is increasingly popular in just broadly speaking. It operates much more like a plan that you've had through an employer-sponsored coverage. There's a network of providers, so it doesn't give you the same broad access to all Medicare providers, all providers who accept Medicare. It does come with some additional benefits that are not covered by traditional Medicare. So that's a plus. It also tends to be less expensive premium-wise than Medicare Supplement. So it's a different option. And also, you know, it operates like a managed care company. So the health plan will review services, can in some cases deny coverage for services that are not medically necessary. It's a different kind of plan. but it's, we've got a portion of our membership that that is especially premium sensitive, and this allows us to offer them a different kind of value proposition with this plan. I don't know if anybody on my team wants to add or correct anything I said there. Just one other comment around Medicare Advantage and mass retirees is really great about always reminding retirees, if you're interested in a Medicare Advantage plan, enroll in the GIC's Medicare plan rather than enrolling in an individual plan that you'll pay for outside of the GIC. Really do encourage folks to not be tempted by the ads that you see around certain times of the year here to enroll in other coverage. We'd rather have you in the GIC. It's a better deal.
Thank you. And continuing on with the Medicare questions, how does one determine their eligibility for Medicare?
I'll ask Paul Murphy to answer that one.
Medicare determination is determined by the Social Security Administration. So as I said earlier, when you get a letter from GIC, when you turn age 65, you must apply through the Social Security Administration to get an answer on whether or not you qualify for Medicare Part A, for B, and Part B. If you qualify for Medicare Part A and Part B, then you can choose a Medicare supplemental plan with the GIC. If you do not qualify for Medicare A and B, when you turn age 65, then you remain in the non-Medicare plan that you have with GIC. But the ultimate determination comes from the Social Security Administration regarding eligibility.
Thank you, Paul. And we have another question from members who are currently still employed but are planning on retiring after annual enrollment. If we could give a high level on the steps they will need to take.
If you're planning on retiring anytime throughout the year, the first thing we would recommend is that you let your agency, payroll, HR, or GIC coordinator at your agency know that you're retiring. There is an application called a GIC Form 1A that needs to be completed by you and signed and sent into the GIC. That will start the process for GIC to transition you from employee benefits to a retiree. It'll set you up on a billing. We'll bill you 3 to 4 months after you leave your job, and that's the gap between the time you collect a pension. At such time when you collect a pension, GIC will deduct the premiums, but during that interim, we bill you. So the first step we would recommend is to complete that Form 1A with your agency and send it into GIC roughly 30 to 45 days before you retire. If you are over age 65 when you retire from the Commonwealth, GIC will then follow up with the Medicare letter that I talked about earlier, asking you to enroll in a Medicare plan with the GIC, but that will follow once we start the retirement process and we receive your Form 1A.
Thank you. And sticking with Medicare, there's a question about what type of coverage is offered with the Medicare plans if you are traveling overseas.
If you were traveling overseas, all of the plans cover you in emergency situations. If you were going to permanently reside internationally, then the Unicare Total Choice Plan is the plan, but all plans will cover you in emergency situations, whether you're in the country or out of the country. And looking at the slide that is up on here now, people that want to know if they have national coverage, as Matt talked about earlier, we have the Harvard Pilgrim Medicare Enhanced, the supplemental plan with Health New England, and the Unicare Medicare Extension. Those are all nationwide plans to any provider or hospital that accepts Medicare. The Tufts Medicare Preferred Plan, as Matt talked about earlier, is a Massachusetts-based plan, and it has limited hospital and doctors. But if your hospital and doctors that you currently use are in that network, it's a good plan too. But some are limited based on where you reside. Some are national based on whether you travel or live outside of Massachusetts.
Thank you, Paul. And we have a question about what if my spouse is eligible for Medicare, but I am not? How do I choose a plan?
What would happen is when your spouse turns age 65, GIC will also send a letter that I talked about earlier, 3 months before the 65th birthday. Your spouse can elect a Medicare plan with the GIC, and you as the member, if you are under age 65, can remain in a non-Medicare plan. So for instance, if you have a family plan today and you have a spouse turning 65, the spouse can go into an individual Medicare plan, any plan that you see on the screen here, and you as the member can stay in the non-Medicare plan until such time you become eligible or turn age 65. So we treat it as two individual policies depending on who is turning 65.
Good question.
Thank you. Now if we can advance to the non-Medicare plan mapping slide again. And we have a few questions relating to those plans. Thank you. Okay, and the first question is, what coverage is best if you're residing overseas?
If you are residing overseas, then if you look at the second option down, New England and international residents, it's the Unicare Total Choice Plan.
Thank you. And question of, if I'm retired but have a dependent who is under the age of 26, what are my options for covering them?
That may be a Cameron question or a Paul question.
I
Paul,
can
you
answer
want
it.
to? Yeah,
Sure.
go ahead.
Yeah. If you have dependents covered under your policy, they can remain covered on your policy even when you or your spouse turns age 65. Depending on how many people are covered under your plan, you will either be required to continue the family plan to cover a dependent, or you can elect an individual Medicare plan if you or the spouse are age 65. So the coverage doesn't end. It just depends on whether you can have an individual policy with Medicare and an individual policy for if you're only covering one dependent, or if you have multiple dependents under your plan, then you're allowed to continue that family coverage even when you go on Medicare.
Thank you, Paul. And continuing with the dependents topic, what options are available if you have dependents who reside outside of New England, but you as the enrollee and reside inside of New England?
The key here would be is based on where the member resides. So some of the changes this year that if you live within New England, there are many choices that you have regarding Unicare Plus, Harvard Pilgrim Explorer, and the Unicare Total Choice Plan. All of those plans can cover dependents that live out of state. But we recommend that you contact the plan for out-of-network benefits, but you can continue to cover your dependent while you live in Massachusetts if the dependent lives out of state.
Thank you. And we're receiving a number of questions asking what options are available if you are not yet 65, but your spouse is 65.
Go ahead, Paul.
Sure. So what happens if you are not age 65, but your spouse is age 65? If he or she is eligible for Medicare, they must enroll in the Medicare supplemental plan with the GIC. And we will send the letter out, as I said earlier, 3 months before the 65th birthday. So your spouse is eligible to elect any GIC Medicare plan that we offer. You as the member under age 65 can enroll in any of GIC's non-Medicare plans that we offer. So we treat it as two individuals, and both of you can elect Medicare and a non-Medicare plan with the GIC.
Thank you, Paul. We have a question about qualifying events. If a member moves outside of New England after annual enrollment, will that be a qualifying event to change their coverage?
Yes, moving out of the health plan service area is a qualifying event. So if it happens after annual enrollment, the member can advise GIC of their new address, and we make that transition to the new plan outside of New England. It doesn't have to be done during annual enrollment. It can be done at the time the member moves.
Thank you, Paul. And I see our staff is quickly answering questions. See a question about basic life insurance. Does it cover both a retiree and spouse?
The basic life insurance only covers the member. The $5,000 policy is only for the member. We do not have any life insurance for spouse or dependents.
Great, thank you, Paul. And we are receiving a number of questions about CIC again. I think, Matt, if we can just go back over what, if any, action members will need to take and what the new approach to CIC coverage means.
Yep. So this is one of those features of GIC coverage that if you're in the Unicare plan, you're probably much more familiar with it. If you're not in the Unicare plan, you may not really have a sense of what this is. So the CIC coverage was additional coverage for certain services on top of Unicare Basic to make sure that it's comprehensive coverage. For a variety of reasons, we set up the CIC program as a member pay all portion, and so the member covers the entire additional premium there. So what we are doing is essentially retiring the CIC program. What this means for the member is that you will get the same coverage that was covered by CIC, but you won't have to pay the whole extra premium. That will now be folded into the regular premium for the plan. And so it'll be, you know, if today you're in a plan and you're in that plan and the state pays 90% of the premium, they will now pay 90% of that additional cost. So this is really good news for the member. You get the same coverage that you had with CIC in the past, but you don't have to pay the full freight of that extra cost.
Thank you, Matt. And can you just clarify again if there are any changes to the Medicare pharmacy benefit manager?
There is no change. If you're enrolled in a Medicare plan, it will continue to be CVS. But if you're in the non-Medicare plans, that's where Express Scripts is your pharmacy benefit manager today. You will also be moving to CVS Caremark. I do want to note on this that this change in how we manage our benefits moving to CVS does not mean that you can only use CVS pharmacies. For those of you who have CVS today under Medicare or have Express Scripts today in a non-Medicare plan, you have access to a wide range of retail pharmacies, including those that are not CVS retail pharmacies. That is not changing. You will continue to have broad access to retail pharmacies to fill your prescriptions.
Thank you, Matt. And it seems like we have a number of retirees who will turn 65 during the annual enrollment period and are just looking for clarification on what steps they should take to ensure they are covered.
Sure, I can do that, Emily.
Mhm.
If a member's turning age 65 during annual enrollment, it's the same process. GIC will send the letter out 3 months before the 65th birthday to transition you and or your spouse into a Medicare plan. So you don't need to worry about the annual enrollment period. This turning 65 process is separate from the annual enrollment period. So we handle that by sending the letter and transition you into the Medicare plan. There's no need to worry about selecting a Medicare plan during open enrollment.
Wonderful. Thank you, Paul. Sorry, as our staff on deck is quickly answering questions, I'm looking for questions that will apply broadly.
I did see one that I can address. It was a question about whether the same outpatient behavioral health providers who are covered by Tufts today would be covered by the Harvard Pilgrim plan that we've mapped folks to. It's a very good question, and that's an excellent question to ask of the Harvard Pilgrim, the folks at Harvard Pilgrim. So you can, again, as I said earlier, you can look on the online to view their provider directory, but you can also pick up the phone and call them at the number that we included here on that reference slide, and just ask them the answer, because there may be some changes there that you're going to want to be aware of. I believe the network will be somewhat different on the behavioral health side.
Thank you. And we're getting a number of questions asking how to determine if a medication will continue to be covered under the new pharmacy benefit manager.
Yeah, I could call on Janine Dewar to speak to that. Janine manages our work with our pharmacy benefit managers. Janine?
I'm sorry, can you repeat the question?
Yes. How can a member ensure that their medication is still going to be covered, or how can they confirm if their medication is still going to be covered under the new pharmacy benefit manager?
You'll be able to call CVS. If you're in SilverScript currently, it's really the same process. You should be able to call the SilverScript number. There will be one phone number for both Caremark and SilverScript. We should be able to check online through their microsite, which is available. You can find all the contact information at mass.gov/GIC, and the Caremark site will be effective completely within the next 2 weeks, in case you're changing over to Caremark from ESI, Express Scripts.
Thank you, Janine. And I think if we can just clarify again, we're still receiving a number of questions about what coverage options are available. If your spouse is over 65, but not a state employee, but you are still, but you are a retired state employee, what options are available?
I think what I can do is probably give an example. If you are retired and you are under age 65 and your spouse is over age 65 or turning 65, You as the member can elect any non-Medicare plan that the GIC offers. So in looking at this chart here, we have the Unicare Total Choice, we have the Harvard Explorer, we have the Health New England plan, we have many different non-Medicare plans for you as the member under age 65. For your spouse who is age 65 or older, he or she can enroll in any Medicare plan that the GIC offers when they turn age 65. So you can have a combination. So you as the member could be enrolled in Unicare Total Choice. And when your spouse is Medicare eligible, your spouse could be in the Harvard Medicare Enhanced plan. So it really depends on your needs, hospitals and doctors. I would encourage anyone to look at the benefits at a glance in a retiree benefit decision guide that'll be posted on our website prior to annual enrollment to look at the different plan options. But it really becomes based on your health needs, doctors and hospitals that you like to use. But you can have a combination of any non-Medicare plan and a Medicare plan for spouses that are over 65 or you as the member under age 65 or vice versa. So there's many different combinations of coverages, and it varies on how many people you're covering under your plan too, whether you have to continue a non-Medicare family plan because you may have a spouse and 2 or 3 dependents, or you're only covering a spouse. So there are different plan options, but I would encourage everyone to look at the benefit at a glance grid that is in the retiree benefit decision guide. There's one for the Medicare plans, which outlines all of the copays and deductibles, and the non-Medicare plans that outlines the copays and deductibles, and both premiums are in those books. So it really is a combination of whatever your health needs are, but you can combine the benefits between non-Medicare any plan or Medicare any Medicare plan we offer. The only time where you don't have a choice is that if you are in a Medicare plan, say you're in the Unicare Medicare Extension Plan, for example, and you have a spouse turning age 65, your spouse must go into the same Medicare plan as you, so that both husband and wife have to be in the same Medicare plan. You cannot choose different Medicare plans. The family, you and your spouse, must be in the same Medicare plan. So you can change to another Medicare plan, say Harvard Medicare Enhanced, but both of you need to be in the same Medicare plan. It does not become a combination where you can pick one plan, Medicare plan for you, and another Medicare plan for your spouse. It's got to be the same plan when both of you are age 65 on Medicare.
Thank you for expanding on that, Paul.
Emily, I'm going to take a question that I've seen in the thread here. If one can use a number of non-CVS pharmacies, what is the value of using CVS Caremark? It's a very good question. So this goes back to the recontracting that we do. As I said, at least every 5 years, we have to recontract with all of our vendors. That includes our pharmacy benefit managers. We went through that process last year. One of the benefits of doing that recontracting is that you can get more favorable contract terms. And in this case, moving from Express Scripts to CVS Caremark as a pharmacy benefit manager, PBM, actually allows us to deliver pharmacy benefits at a lower cost than what it would have been moving forward with Express Scripts. So it has less to do with how the pharmacy benefit manager interacts with the retail pharmacies. For us, it's delivering the broad services of pharmacy benefits and our ability to do that at the lowest cost for all of our members.
Thank you, Matt.
I also saw a question someone had whether the CIC program was also being folded into the Access America plan for those who live out of area in the non-Medicare plans. The answer is yes.
Thank you. And this is similar to the turning 65 question that Paul answered earlier, but I see questions about if members will be retiring during the annual enrollment period, if they will need to take any different action or what types of action they should take.
The only action the member needs to take is that if you are retiring during the annual enrollment period, the form that I talked about earlier, GIC Form 1A, that needs to be completed to start the process of us transitioning you into retirement. So that form is important, that you complete that form and let us know what your date of retirement is and send that to us 30 to 45 days before your retirement. If you or your spouse are over age 65 after you retire, we will start the process and notify you by letter on Medicare eligibility. So nothing needs to be done as far as the annual enrollment changing plans. The Form 1A is important to start the retirement process, and the Medicare letter, if you or your spouse are over age 65, will follow. So there's no change for annual enrollment to worry about. I also want to state that if you are retiring in the future, retirement is a qualifying event. So at retirement, whether it's during annual enrollment or anytime during the year, you can change your health plan at retirement. It's a qualifying event. So if you're in the Unicare Total Choice when you retire, say in September, you can change to the Harvard Pilgrim Explorer plan at retirement. So you have a small mini open enrollment at retirement where you can change your plan, but thereafter, once you retire, you can only make the change during the annual enrollment. Emily, I also see a lot of questions regarding retiree dental, and I'd just like to mention that retirees, when you retire, you can sign up for GIC's retiree dental. That is one option available to you. Now, many employees, while they work for the Commonwealth, are covered through unions, and they have the dental benefit through the union. What we recommend you do is at that time when you retire and you're covered to a union plan, you have a choice at retirement. You can either continue that union plan through COBRA once you leave the Commonwealth, or you can enroll in GIC retiree dental plan. You have to do the homework. You have to look the difference between your plan you have with your union and the GIC retiree dental plan. But the choice is yours, how you want to continue it. If you continue no coverage once you retire with dental, then you can come in during any open enrollment period for GIC's retiree dental plan. So if you don't take it now when you retire, you can sign up anytime during an annual enrollment period. One word of caution, if you do sign up for the GIC retiree dental plan and you cancel it, you can never get the coverage back. There is a lockout on that plan. So it's important to remember that if you sign up and you cancel, you can't come back in. But we would recommend do the comparison between the COBRA and the retiree dental and make the choice. If you choose your union, for example, the COBRA through the union to continue your dental, that usually goes for 18 months when you leave. At the end of 18 months, at that point, GIC will allow you to go on the GIC retirement dental plan at that point. So you don't have to worry about if you take the COBRA 18 months from now, it's not an annual enrollment period. When that's over, we will let you into the retiree dental plan.
Thank you for addressing that, Paul. And I do want to remind, I see some questions asking if the materials will be available, and I want to remind everyone that these will be available. The presentation deck is available on our website at mass.gov/GIC, and the recording of these sessions will also be available on our YouTube channel. So you can view everything again at your leisure and view these resources along with the benefit guides, which are also on our website at mass.gov/GIC. And I do see a question about if a member wants to compare from last year's to see what is changing to this year, how they can do so. And there is an archive on the website of previous year benefit guides as well. And if we can just clarify one more time that there is no change to the Medicare PBM coverage.
Can you repeat that, Emily? I'm sorry.
Yeah, I think there's a bit of confusion still on whether or not the Medicare PBM is changing. So I just asked if you could clarify one more time.
Yeah, if you're enrolled in a Medicare plan, your pharmacy benefit is not changing at all. You've had CVS SilverScript, that will continue to be the case. The coverage is not changing. The company we work with is not changing. So that is not changing.
Thank you. And I see there are a lot of questions that apply to individual members that our staff is busy answering in the Q&A function. I would like to give them time to answer those. We do have a question of if FSA is available to retirees.
I'm happy to answer that if you'd like.
Sure.
Yes,
Thank
go
you,
ahead.
Cameron.
Yep.
Yeah, I've seen a few FSA questions come through. FSA's flexible spending accounts are only funded by employee payroll withholding, so it can't be withheld from a pension payment. So FSAs are only available to active employees. We've also seen some questions as to whether or not an HSA is available. The GIC does not offer any medical plans that are compatible with health savings accounts. Also seen a couple of questions as to what happens to any FSA funds upon retirement. When you retire, you are no longer actively employed, so you can no longer continue to make contributions. However, you can continue your FSA participation by electing COBRA, and you could either change your election amount at that point or continue to pay the administrative fee throughout the remainder of that plan year. So direct billed to the FSA administrator, and that would allow you to spend down the rest of your account and any remaining balances. I believe that's probably it for the FSAs based on what I've seen so far.
Wonderful. Thank you, Cameron, for clarifying that. And I see questions about finding the resources. You should see in the chat function a number of resources shared by Mike Berry from our staff. This includes a link to the benefit guides, to the list of qualifying events for when you can make changes outside of annual enrollment, the link to the Turning 65 page for steps you need to take prior to turning 65, and the link to the presentation, as well as the contact form if you have personal questions that you were not able to ask today. And he has also just included the link to the YouTube channel where you will be able to find a recording of this session, as well as if there are any non-retiree members who are thinking of retiring, so attended these sessions, the active sessions, once they are held, will also have recordings on the YouTube channel.
I saw a question, Emily. Someone asked if their pharmacy benefit manager is changing, being the non-Medicare enrollees from Express Scripts to CVS, is there anything that they need to do? As it relates to your coverage, the answer is no. We will automatically change your coverage. I did have a slide that I spoke to about things that you're going to want to be aware of in terms of what drugs are covered, kind of how the transition will be handled. You will receive a packet from CVS that will include essentially all that you'll need to know to prepare for the change. But as it relates to annual enrollment, you do not have to select or actually do anything in terms of the your benefit elections.
Thank you, Matt. And again, as we are nearing the end of this session, I just want to make sure I give the staff who's busy answering questions some time to answer the remaining questions, some of which we have addressed verbally here, but want to give some time. And I do want to clarify, in addition to all of the links that have been shared in the chat today, you can always find all of these resources, or you can find the path to find these resources on our website. So mass.gov, mass.gov/GIC is the one link that you will want to keep in mind if you're ever looking for any of these resources. And again, thank you everyone for joining today. I'm still just allowing our staff to continue answering some of these more specific questions. And I think we should also clarify again that for municipal retirees and enrollees, you will want to make sure that you're checking in with your city or town about rates. I do see one last question about, again, turning 65. If a spouse is turning 65, what type of paperwork is sent to the family? Or is there a letter sent to both the spouse and to the member who is not turning 65, or only to the member who is turning 65?
The letter from GIC comes 3 months before the member or spouse's 65th birthday. And it comes directly from the GIC, and it only goes to the member and or the spouse that is turning 65. Nothing is sent to the member who is under age 65.
Thank you, Paul. And again, you can find all of the information, this presentation and the benefit guides on our website at mass.gov/GIC. And all of the information that was shared today from the rates and the plan mapping is included in the benefit guide. So we do encourage you to review those benefit guides as you are evaluating all of your options ahead of annual enrollment. Okay, and if we can just go back to the slide, reminding for the dates on annual enrollment, those are the key dates here, is that you evaluate all of your options. And if you do want to make any changes, that you get all of your paperwork in prior to May 3rd.
All right, well, we're just about at 1:30, so I will wrap this up. Thank you all for joining us. I see we actually still have over 140 participants. Really appreciate you taking the time. I hope this was a helpful preview for the changes that are coming. I hope one of your takeaways is that this is an excellent year to really be engaged in making decisions about your coverage. We tried to keep our benefits as stable as we can for reasons that I've mentioned here. On occasion, we have to make changes so that we can continue to meet our mission to provide you quality benefits that you can afford. So this is a great year to really kind of review your materials, make sure that this coverage that you choose meets your needs. So hope this is helpful for that. Keep an eye out for the materials coming your way. And please, if there's any ways that we can be helpful to you, please reach out to us at the GIC. And I want to thank my team for the team of the GIC for conducting this. So thank you all. Have a great day.